With us today, as I mentioned a little bit earlier, we're going to be talking about chiropractic. Today, our guest is Dr. Phil Uphold, and he's going to be sharing with us about some very interesting things. I think a lot of folks, Dr. Phil, sometimes think about chiropractic and there's maybe a little bit of uncertainty. They don't know a lot about it. Maybe they've had a family member or a friend who's told them about it, but we don't know, so we're looking forward to learning a few things. Awesome. But I understand that you come from kind of a family of chiropractors. So how does that work? How did you get involved with chiropractic work?
Well, it started when I was younger. I actually got involved with chiropractic going to a chiropractor. My girlfriend's dad was a chiropractor. Oh, okay. And I had a sports injury from pole vault, and so I decided that I want to start getting some chiropractic care from him and help my hip immensely. And then my girlfriend and I ended up getting married.
Oh, awesome. Well,
and so I decided that I wanted to become a chiropractor. I always thought I wanted to be a dentist or something in that field to help people. And so I decided to become a chiropractor.
We're still helping people.
Yeah, I'm still helping people. And so in that family, Randy Sussex from Farmington, New Mexico, Grandpa was a chiropractor, Dad was a chiropractor, sister, uncle. So there's about 6 chiropractors in that family from Sussex Chiropractic. And
that's awesome.
Wonderful.
Yeah, so I married into the practice. So
there you go.
Their tag is three generations of chiropractors. So,
that's great. Yeah. And how long have you been in practice now?
So I've been in practice now for 10 years this year. Okay. 8 years I was with Sussex Chiropractic in Farmington. And then 2 years ago, Alan Miner from HealthQuest Chiropractic asked me to come down, and we had a very similar vision in mind. And we were able to start to open up multiple offices for HealthQuest. And so I came down and I took over the main HealthQuest office after 8 years with Sussex Chiropractic.
So you're new to Albuquerque, but you like it?
I am new to Albuquerque, yeah, and we're loving it. My family's liking it here.
Good.
Yeah.
So you mentioned that HealthQuest is the group that you're with.
It is.
And
yes.
You, I think, also alluded to the fact that you have more than one location. So tell us a little bit about HealthQuest. What are they like compared to maybe some other chiropractic groups?
So HealthQuest is very unique. I'll tell you, one of the things that drew me to HealthQuest the first time was stepping in the office. It was an experience that I had never seen before. We do open adjusting. We do that because we want to have a sense of community, and we want people to know that it's a safe environment. And I want you to see all the children that come in the office. I want to see the people that are coming in wheelchairs. I want you to see people that have all these different problems, and then you can sit and talk amongst yourselves about what's going on as these adjustments happen. So it's a very family-oriented community group. And so that was the first thing I noticed when I walked in the door. I was like, wow, this is really different than what I've seen before.
Wow.
Okay.
So have you opted to participate with health insurance plans?
So we do not participate. We're non-network providers.
Okay.
So we do not. We're not in network, I say, with insurance companies.
Right.
But what we found out, especially this year, like I was telling you guys earlier, is that our copays for specialists have gone so high up that the price of a copay is actually more expensive than our normal adjustment prices.
Wow.
And so we're able to help people with that. And we do give significant discounts to people that decide that they want to commit to getting care for us for a period of time.
Why don't you give us a little bit of a range? I mean, what would somebody maybe typically expect if they walked in for the first time?
If you call my office and ask for a visit, normally it's $250.
Okay.
For your guys' viewers today, we'll do it for $99.
Oh, wow. So somebody comes in, they've never done that, it's maybe around $100 they can get in for a first time and get in it. Is that an evaluation? Or
So it is evaluation. It's a very thorough evaluation. We're going to sit down, I'm going to do a history with you, find out why you're there, what are your goals, what do you want to achieve by coming to my office.
Okay.
And then we're going to do an examination, orthopedic, neurological testings. If I look at you and we do a posture analysis and your history indicates it, we're going to do some x-rays. We use digital x-rays, so we use state-of-the-art technologies in our office.
Great.
So if we need to, we'll take those x-rays. Then we'll use a thing called the Insight system, and it's NASA certified technology.
Okay.
And I'm telling you, this is the coolest stuff because it really takes, if you will, like a photograph of your nervous system for us. And that's what we're concerned about in chiropractic, is your nervous system.
Wow, that's cool.
So you're working with the nerves and trying to get all of them to function in the way that they were designed.
That's right. Our bodies were designed a specific way. We feel that God doesn't make junk, right?
No, right. That's right.
There's a design behind this body.
Yes.
That's right.
And so what we would do is we work with that. And in chiropractic, if there's interference due to these stresses that we have, these physical stresses, chemical stresses, emotional stresses that everybody deals with, right? Then we've built up these things, and we call those subluxations. And the subluxation, it's not a nerve on a bone per se, is what maybe we've been taught.
Right.
But it's really a lack of communication between the brain and through this nervous system to the rest of our body, to all the organs, cells, muscles, tissues in our body. And so that's what we do. We assess that. And I always tell people when they come to my office, if you come in and bring me your child and they have an ear infection, If you come to me because you have a low back problem,
Right.
I don't treat low back pain. I don't treat kids that have ear infections. I don't treat these things. I don't even treat subluxation. But what we do is we look for subluxation, and when we find the subluxation and we adjust the subluxation, it's amazing how the body will start to heal itself on its own. And that's where healing comes from. You know, power that made the body heals the body, and that's what we work with.
Now, how often do you recommend someone coming and seeing you? I know you talked about doing a bundle.
Yes.
Should they come monthly, or do you assess that as well?
We do. You know, we assess that. We give you a plan. You'll know everything on the second visit. But I do have to assess what's going on with your body. Like I said, we do the first visit. You come back for a second visit. That $99 that you'll be paying when you come in will go towards your adjustment also. So there will be no additional charges for your adjustment on the second visit. But it gives me time to really analyze what's going on with your body so that I can make a decision on what we got to do. And if I can help you, I'm going to tell you, hey, this is what it's going to cost. This is how long I think you got to come for. And you know, this is what we can anticipate seeing while we're doing these corrections.
I know you mentioned that you might see kids there. Now, that's kind of a different thought.
Yeah.
Do you do things with children?
We do. We see lots of children, and it started from my own children getting chiropractic care. When I first got into chiropractic, I didn't really make that correlation myself. It was something that, through my own personal experiences with my son and with my daughter, and my other son, but specifically those two, seeing some of the challenges that they had after birth, and getting involved with pediatric chiropractic, that I started to go and get more information about this, because I saw such amazing changes in my son, who had some significant problems when he was first born.
Now, is that something you specialize in? Is that something you?
Yeah, so there's a group called the ICPA,
Okay.
International Pediatric Chiropractic Association, so I've done all my training through them.
Awesome.
Wonderful.
Wow.
Do you have a miracle story or something that you'd say, now this really kind of illustrates the point of how chiropractic works?
You know, I honestly, I see miracles every single day. But the ones that touch me the most are definitely the babies. And so within the last 3 months, I guess it's been 3 months now, I have had a little boy that came in that is sensory deficit disorder. And this is a child that didn't like to be touched, so it's very hard to do an exam, if you can imagine trying to do an exam on him. It's very hard to get him to do our insight system, where we actually have to touch the body and scan him. Doesn't like to take his shirt off. It's hard to get him out of the playroom to even get him into the exam room, so we did a lot of our stuff in the playroom. You know, when it's exam time in my office, and I go and our office is pretty much closed during exam time. And when it's adjusting time, it's adjusting time. It's a very busy and robust time. But so that time it's pretty quiet, and so we were able to do our exam in the playroom. And it took a little convincing to get Dad to buy into the fact that, hey, I think we can help this child. You know, he only speaks, he's 3 years old, he only speaks like 5 words and not very coherently. He had never said his name, he'd never said mommy. You know, he'd never said these things. Like I said, he didn't like to be touched. He threw a lot of tantrum, you know, a lot of fits. And so we were able to get him under chiropractic care. And they started off with 12 visits, and they saw significant changes. So much that they brought in their speech therapist to come in to find out, what the heck are you guys doing over here, because I've never heard of this before.
Wow.
And it wasn't that I was treating him for sensory deficit disorder, it was that I was treating him for those miscommunications, those subluxations that were present. And whenever that clicks inside their little brain and it starts firing, it's amazing. You know, now his vocabulary is over 250 words, and he's saying things like his own name, which Mama said that was an aha moment for her.
I bet, yeah.
And he said his own name. She's like, he's never done that before.
Wow.
And so, you know, they've continued on with care. They feel that it's important. Now they're bringing in their younger child for it, the one that's a little bit younger than him, about 2 years.
That's awesome.
Yeah.
So that's an exciting story.
And I'll tell you that kids don't even have to come in because they have a problem like that. We feel it's important. This nervous system is going to double and triple in size by the time we go from 0 to 20 years old. So we know that this is the master control center of the body. So why wouldn't we want to get that checked and make sure it's developing as best as possible, so we can develop mentally, physically, and socially at 100%.
Wow.
Do you have adults that come in for specific things? I would think it would always mostly be back problems.
Yeah, you know, we get that every day.
No?
So you know, whenever I'm out there on the street and I meet people at different places and they say, "Oh, you're a chiropractor." Well, Doc, I got this problem in my back. You know, can you check it out? And I'll tell you that.
Here in the grocery store or wherever, right?
We have a lot of people that come to us because they have headache, neck pain, back pain. It's been an auto accident, and that's kind of what typically we've been, if you will, framed as back pain, neck pain, musculoskeletal doctors. And to me, it's so much deeper than that. We're glad to take people in and take care of them for those reasons. But educating them is my most important thing I can do for them. And so we do a lot of educational seminars almost every Tuesday night at 5:30 in my office. We're having seminars on different subjects. We're bringing in specialists that are like-minded like myself and like the rest of our doctors to talk on topics of health and nutrition and exercise. And we have a doctor that's doing thermography for breast cancer detection that's coming into our office in October during Breast Cancer Month.
Wow.
So we're always bringing people in that have, what's the latest, newest stuff out there that's working.
Well, I think we could even go a lot longer, but we're going to have to break away. So good to have with us Dr. Phil Uphold, as he's been sharing with us about chiropractic, and he's with HealthQuest. I know there's been some great information available for you on the screen. Hope you'll get in touch with them so that you can find out more.